Hello, family. Trust you've been great. So, talking about diastasis recti, that is abdominal separation. The left and right side of the abdominal muscles are joined together by what is called linea alba. It's a tendon, a fibrous tissue made up of collagen connective tissue. It's sort of like a zip. Let me call it a zip. Let me use that illustration. It's not a zip, but let's call it a zip. So what happens in abdominal separation is just like what happens with a zip. When a zip becomes weak, and say you wear something fitted and it just tears open on its own. That's what happens with that connective tissue that separates the two sides of the stomach. When that tissue becomes weak, it starts to tear open at the middle gradually. Abdominal separation, that's what causes weakness in that tissue and cause it to start opening, is usually as a result of anything that causes the stomach to bulge. So either as a result of pregnancy or obesity. Now, when you're trying to reverse abdominal separation, let me first of all say that it requires a lot of patience. It's not something that will happen overnight. If you're willing to be patient, with patience and consistency, you are sure to see results. Reversing abdominal separation can take anywhere from maybe even 6 months to 1 year. So understand me when I say that patience and consistency is really important. I have worked with several women who had abdominal separation, but then they were patient and they were consistent in applying the recommendations I gave them, and they did get remarkable results. The first thing you want to do when you have abdominal separation is to avoid anything that will cause further expansion of the stomach. That will mean that you should avoid adding extra weight and rather work on reducing your body weight to your ideal body weight. Because when you are working on reversing abdominal separation and then still expanding in weight, you will not get any results. And so it's important that when you're working on reversing abdominal separation, you're actually shrinking in size till you get to your, not shrinking and become excessively thin, but then at least to a normal weight. Another thing you want to avoid is anything that causes the stomach to bulge out, that causes that cone on the stomach. That will include exercises or any kind of movement that causes that cone on the stomach. When I say cone, you see when you do some moves and your stomach just form like a round bulge at the middle, right? You have to avoid any kind of moves, any kind of physical activity, any kind of exercise that causes that bulge, that coning, on the stomach. Rather, you are focusing on movements, especially with exercises, movements that enables you contract your stomach as if towards your spine. That will also mean that you should avoid bending, like when you bend to lift something from the ground, or when you bend to sweep, or even when you bend like to lift a child, right? The more you bend, because remember I said I was going to be illustrating, use the word zip, right? Because that's zip, that connective tissue that holds everything together, that holds all the stomach, the organs and everything together, because that zip has opened, everything will keep pushing out, right? Putting pressure and expanding the opening even more. When you bend, you are causing all the weight of your internal organs to rest on that connective tissue that is already weak. So it will just keep opening and opening and opening, the more you do activities that causes the stomach to bulge. So when you have abdominal separation, rather than leaning from your front to pick up something, learn to lean from your side to pick up, bend from your side to pick up stuff instead, right? Because when you lean from the front, you are putting more pressure on that separation and worsening it. Of course, you may not always be able to avoid leaning from the front, but as much as possible. So you just have that consciousness that the more you put pressure on that opening, the wider it gets. So when you have that consciousness, it reminds you to be more careful to not put pressure on it. So another very, very important thing you want to learn to do when you have abdominal separation is to learn to contract your stomach. They call it vacuum. Vacuum is an exercise that works to bring the two sides of the stomach that are separated together. Do you understand? When you contract your stomach, you bring the two separated sides of the stomach together. But here's something that is very important to note that I would like to mention at this point. Why, for some people, if you do not have severe abdominal separation, you can do vacuum standing. Vacuum, I'm sure that a lot of people already know that. It's like, when people say suck your stomach inside, maybe when you are trying to not let you're wearing some sort of clothes and you don't want to make your stomach look big in the clothes, and you just suck the stomach muscles inside and it's like your stomach becomes flat. That's vacuum, right? So now, something that is very important to note is that for some people, when the separation is severe and you do vacuum standing, you may hurt yourself, because some people's separation is so severe that you already have your internal organs, intestines and stuff like that coming out sort of through that separation. And so I always recommend, whether it's severe or not, I always recommend that you do vacuum lying down rather than standing. Because when you lie down, all the organs are resting away from that separation. So you don't stand the risk of, squeezing your organs through that separation, when your internal organs through that separation, when you contract. So when you lie on your back, you try to squeeze your stomach, contract your stomach like you're squeezing into your spine, right? But then take it gradually. Start with baby steps. Don't over try to contract it in a way that it becomes uncomfortable for you. Just try to squeeze gradually, and then from there, as you're getting comfortable, you are squeezing even tighter and tighter, but don't overdo it at the initial stage. Vacuum is one very powerful exercise that really works in helping that connective tissue heal. I can assure you of that. But then, like I said, you want to ensure that you lose excess abdominal fat, so that you know that what you're dealing with is just to close that separation. Do you understand? When you have excess fat and you are trying to reverse the abdominal separation, you won't get much result. But when you know that you have worked on eliminating excess fat and all you are left with is just maybe some excess skin and then abdominal separation, it becomes easy for you to start seeing results. Now, in my first bootcamp, I'm going to be giving some extra tips, especially when it comes to exercises that can also help people, both people with FUPA and people with abdominal separation, so that you can just get some. Remember, I said it must not necessarily be flat, but then significantly flat. Talk to you soon.